going to talk about navigating prescription drug costs. Why are they so expensive? Is there any relief in sight? And what can we, the consumers, do to reduce the out-of-pocket costs we're all experiencing? I'm sure you've all read in a paper about people who have been reducing their medication, not filling their prescription, cutting their drugs in half, buying a substitute drug, and getting into trouble, getting sicker. So we're taking a look at that. A Health and Human Services report from 2016 through 2022 showed drug prices are rising faster than inflation. There are several reasons this is happening. Manufacturer profits, we'll start there. Now, the pharmaceutical companies have developed and produced medications that treat conditions that we thought previously were untreatable, and they managed to get us cures. We're thankful for that, and we acknowledge that it costs a lot to research and develop new medications. Costs can range from hundreds of millions of dollars to $2 billion. Isn't that an incredible figure for one medication? It costs about $6 a person in the U.S. if you break it down that way. Well, when the new drug reaches the market, companies charge a price to recover their investment and make a profit. Standard business practice. And that investment also has to cover the 9 out of 10 drugs that fail in clinical trials and never make it to the market. But we also have to look at the fact that the industry has fat profit margins. The gross profit margins for 2021 range between 60.9% for AstraZeneca and 82% for Novo Nordisk. And that's on the website Fierce Farm. You can look at the statistics there. Next is the pharmacy benefit managers. Have you seen the commercial that's been on TV lately with the insurance companies going after the pharmacy benefit managers? It's pretty funny, I think. And, the PBMs, as they're also known, they're the middleman that pay our claims. So when you submit your claim, you're not going to the drug manufacturer, you're going to the pharmacy benefit manager. They're a third-party administrator, and they do commercial health plans, self-insured employee health plans, Medicare Part D, the Federal Employees Health Benefits Program, and state government employees. So they're primarily responsible for processing and paying prescription drug claims. In addition, they negotiate discounts and rebates with drug manufacturers. So they're going to steer those prescriptions in that direction. And they track with pharmacies, and they develop and maintain the drug formulary. Does everybody know what the drug formulary is? Okay. When prescription drug benefits were added to Medicare under a 2003 law, the pharmaceutical industry successfully lobbied to prohibit the federal government from using its huge purchasing power to negotiate drug prices. I remember when that went through, there was a lot of uproar. Private payers, that's the insurance companies, they typically rely on these pharmacy benefit managers, such as Optum Rx, which is United Healthcare Group, Express Scripts, and CVS Caremark to negotiate the discounts. So these three companies I just told you about control 80% of the patient's medicines, according to PhRMA, which is a drug manufacturing organization. So that's Optimum Rx, Express Scripts, and CVS, and I think all of us have dealt with one or more of those in the course of medications. The drug manufacturers claim the insurance company and the pharmacy benefit managers got billions in rebates and discounts that should have gone to patients in 2020. Often the pharmacy benefit managers make exclusive deals with drug makers, which limits the choice of drugs patients have. This comes into play for you when you're claiming pharmacy benefits and they're not in your drug and formulary. And your physician wants to write you a prescription, and that drug is not in your drug formulary, meaning that you're going to pay the entire cost of the drug, or you put your doctor in the position of maybe prescribing a drug he's less familiar with. third is pay for delay. And that pay for delay is pretty interesting. It's an agreement where the patent for the new drug lasts 25 years. And then that, part of that is delays that can be created by getting that drug in agreement with the marketing plan approved by FDA. So the government has that issue going. Sometimes the drug manufacturers also pay other drug manufacturers to delay producing and launching generics, even after that initial patent has expired, after 25 years. So higher priced brand name drugs are people's only option for even longer. EpiPens, you probably have heard, rose from $265 for a 2-pack to more than $600 in 3 years' time. And we've all heard about how the insulin rose astronomically in a very short time. And the price that cost a lot of Americans. Now, drug manufacturers can stall a competitor generic drug from entering the market by filing patents also that cover not only the drug's active ingredients, but the form the drug takes, whether it's a pill or a liquid. And add to that, there have been dozens of generic drugs that have gone up in pricing by 100%. And let's see if we can go to the next. Comparative research. Now, a recent study by the Federal Trade Commission found that lack of comparative research across drugs is yet to be another cause for higher drug spending among Americans. While most healthcare providers are aware that their patients want to avoid high drug prices, their primary goal is to treat the patient effectively. It's often easy to find medical research about the efficacy of particular drugs, but there's much less research comparing drugs to one another. And without that research, the providers may be hesitant to prescribe a less expensive drug that they are less familiar with. They're looking out for their patient's best interest. Market and advertising. A Johns Hopkins Bloomberg School of Public Health study published just this past February, some drug companies have been found to spend more money to market and advertise more than they spend testing and developing the drugs. And I think that's an exaggeration. If you're watching TV, I bet you've heard an advertisement for one or more of the top tier drugs that Medicare spends the most money on. And those are Eliquis, which is anticoagulant blood thinner, Revlimid for cancer treatment, Xarelto, another anticoagulant for AFib, Januvia for diabetes, Trulicity, diabetes, Imbruvica for cancer, Jardiance for diabetes, Avrance for cancer, and Symbicort for asthma, and Humira for rheumatoid arthritis. Have you heard of any of those? Mm-hmm. Yes. I had written in my research, we're all hearing now about Ozempic and Wegovy, which were developed for diabetes, but they're being written off script now for obesity, because they have the same ingredient, different dosage. And I heard on WTOP, just driving here today, that there are counterfeit forms of the Ozempic and Wegovy available online now, so be very careful. Drug manufacturers are hoping you'll ask for these prescriptions by their name. So you got your key takeaways. Drug manufacturers set the price to cover research. The patent system limits competition, the influence of the pharmacy benefit managers, and the need for research. So down to it, ways to save. So just a year ago, in May 2022, Forbes, the global media company, stated that more than half the drugs covered by Medicare have experienced price increases faster than inflation. And even if you don't rely, excuse me, I'm doing that. Paul.
It's on thread.
No, it's unbelievable. Even if you don't rely on Medicare for your prescriptions, there's been hundreds of increases since January 2022. How are we going to get the best price? Work with your pharmacist. And I took a breath on this one, I have to say, because I think you'd have to make an appointment and go see that poor guy over at CVS. He's just like cranking it up. Ask your local pharmacist to look over your medication list, and I think he'll do that for you. You just call and see if you can get a time to get in there, so he can schedule you in the day. They might be able to offer a few money-saving tips that you can then discuss with your doctor. For example, potential generic alternatives, switching your long-term meds to 90-day supplies, or taking advantage of pharmaceutical company discounts. To learn about needy meds, and I'm going to do a little commercial here. Jen Heim, who runs the Tech Talk for LOWLINC, and she does a presentation once a month, she's going to be here in this room on June 28th, and her talk is going to be prescription drug costs and ways to save. And she's going to help you compare the various drug websites that we're going to be talking about, and to provide a sample walkthrough online ordering. I'll be here that day also. You don't have to have attended this program to go to Jen's presentation, so if you want to spread the word, and you can register in advance by calling LOWLINC or going online. So Needy Meds is the first website. Needy Meds is a website that provides information about prescription drug savings. You can search for medications by diagnosis or condition, review different drug manufacturers' savings programs, and look for coupons or rebates. Make sure you verify the information you find with your doctor or your pharmacist. Verify online. Check out RX Assist. That's a database where you can search individual drugs and review prices by pharmacy. Your physician can also use this site to search for drug safety net programs, such as, I'm going to go out here, such as providing assistance to the uninsured or finding a rep for a particular drug in your area who can offer you free samples. And don't be afraid to ask for a free sample. Doctors have samples, or they know where to get them, usually, or they can have somebody research it for you. To qualify for most patient-assisted programs at RX Assist, you'll need to be uninsured, a U.S. citizen, and meet income guidelines. Okay, I'm going to try a cough drop.
Does anybody else want a bottle of water?
Okay.
We have some water over here.
Okay. Last on that page, consider generic drugs. They're drugs prescribed in place of the brand name equivalent. And you can save anywhere from 30 to 80% using a generic drug, according to FDA. The FDA requires that all generics meet stringent criteria compared to their brand name counterparts, and that includes strength, active ingredients, and how it reaches the bloodstream. When your doctor writes a prescription, make sure they check the box, and you've probably seen it at the bottom of the prescription page. The box allows the pharmacy to substitute a generic equivalent for the medication. You can also ask your doctor for medication that offers a generic version. Next, get a prescription for a 90-day supply. And you might be surprised how getting more prescription medication can cost less than a 1-month supply, but it can be true. From mail-order pharmacies to in-store savings programs offered by pharmacies at Walmart or CVS, you can save the most on many medications by getting your doctor to write you a prescription for a 90-day supply. For example, the price of 3 30-day refills on a generic medication at CVS could cost you $10 each month, totaling 30. Somebody's going to have to do this. I'm so sorry. The same, okay, so it could cost you $10 a month for 3 months. Yet the same medication dispensed for 90 days would cost only $15. So you get a 50% savings right there. And at Walmart, they offer a select group of generic drugs that cost only $4 for a month's supply, 30 days. And a 90-day prescription costs only $10. Now, I didn't provide you with that list of drugs because I didn't know they were going to change. All right, 6. We're going to go directly to the manufacturer for drug discounts. If the medication you need is a name brand without a generic available, or if you prefer to use the name brand, you could find discounts directly from the drug manufacturer, but you typically have to meet certain criteria. The pharmacist can locate patient assistance programs using either integrated discount software or by contracting drug companies directly. So again, you want to maybe make an appointment with your pharmacist to get in there for a good review. Do not give them my name. You can also do a web search for drug name and quote savings programs, unquote, that will generally point you to an online portal where you can learn about manufacturers' discount programs, and if you meet the criteria. You must meet either income or geographic requirements to be eligible for discounts. Be aware. Break. Be aware that while manufacturer discount programs can offer substantial savings, you may still pay more than you would with a generic equivalent. Be sure to ask your pharmacist about costs with the manufacturer's savings programs versus what you pay with your insurance and your copay when there's a generic available. Can you hear me when I'm
Yeah,
speaking like that?
Yeah, you're okay.
All right, next is get a free prescription savings cards. You've probably seen this. There's no shortage of them at the drugstores. And you can search online again for the drug you need, including the dosage and quantity, and see which pharmacy in your area offers the drug at the best price. However, if you use a prescription savings card from these programs, you won't be able to use your insurance. For example, you might opt to use a savings card instead of your insurance if the medication isn't on your drug formulary, meaning it's not covered, or if the savings price card is lower than the price you pay with your insurance. So the handout you received when you came in has web addresses from the most popular programs. Remember, Jen Hine will be here on the 28th, and we're going to go through one of these. An important point to remember, if you choose to use a drug savings card instead of paying through insurance, you'll miss out on those dollars counting towards your annual deductible. So depending on your deductible, how your insurance works, and how often you need the medication, consider whether paying the higher price through insurance might make sense. That would apply when your cost after meeting your deductible is lower than using a savings card for an ongoing prescription. Got to do a little math in there. Bottom one, use an online mail order pharmacy. What if you didn't have to go to the drugstore and the savings just landed in your mailbox? That's the bet that upstart online pharmacies like Mark Cuban's Cost Plus Drug Company, Link Health, Genius RX, and Direct are making. While you likely won't be able to use your insurance at these online pharmacies, you might find that paying out of pocket lets you get your medication at a lower price than you would if you used insurance. The only downside to mail order pharmacies is that you won't get your meds right away. So in a case like that, if you need your medication the same day or within the next few days, you probably need to fill your prescription locally and then transfer your prescription to the mail order pharmacy. And don't forget to ask your doctor for a 90-day supply if the savings make sense. Some of the online pharmacies offer conveniences such as automatic refill that makes filling your monthly medication easier and eliminating the risk that you'll run out before you have a chance to get to the store. They also offer discounted meds, 24/7 customer service, support and free fast shipping. If you know that you prefer speaking to a pharmacist in person, it might not make sense for you to use an online pharmacy. Some people may also not feel comfortable using a website to find information and set up their prescriptions, which could lead to inaccuracy and delays in receiving needed medications. So it might be better for those patients to use a in-store pharmacy. The FDA also cautions that some online pharmacies are fraudulent, and that was one of the ones I heard about coming over. Obtaining your medication with them could be dangerous, as the medication could be counterfeit. Think about these warning signs from the FDA when trying to determine if an online pharmacy is legit or possibly fraudulent. They'll let you purchase a drug without a prescription. And their prices and discounts seem unusually cheap. You can join a paid prescription savings program or a prescription assistance program. That's called a PAPS, P-A-P-S. With all the free prescription savings programs out there, you might wonder whether paid services are really necessary. It might come down to your personal preference, especially if you have a long-term relationship with a local pharmacy like Walgreens, which offers a $20 per year prescription savings club. Or you could already be a member of a service like Amazon Prime, which has launched a prescription savings program for its members. Now, while anyone can sign up for Amazon Prime, you've got to weigh that $139 a year cost to be a Prime member. And if that's all you want to do is order prescription medications, and you don't want the videos, or you don't want the 2-day delivery, then it might not make sense for you to use that service. The RX program for Amazon Prime is also $5 a month, plus the discounted cost of your medication. Before investing in a paid program, compare the savings minus the fee with the free prescription drug savings programs. So you really have to do a little homework with your individual prescriptions. Next, know your insurance formulary. With so many prescription drugs on the market, it's hard for you or your doctor to know what will be covered by your prescription drug plan. But you can better equip yourself to save with your insurance plan's formulary if you have that at your side. If your health insurance and prescription plan orders an app, you can install that on your phone and search for covered medications and review costs and coverage before a prescription is written. Work with a hospital social worker. Now, you don't have to be a hospital patient to do that. Those with chronic health conditions, diabetes, cancer, kidney, just for an example, can ask to meet with a social worker at their treatment facility or the hospital. The hospital social workers are knowledgeable about how to search for lower prices on prescription medication. Hospital-based social workers are used to working with patients from a wide variety of economic backgrounds, and they can help you find both local and federal assisted programs that can help with medication costs, along with manufacturer savings programs for these chronic conditions. And last, work with a pharmacy that uses a software program able to search, find, and apply manufacturer's discounts along with being able to use your insurance. And that is so different from what you usually find online, because you've got your insurance, or you can use this coupon, or you can use your prescription savings card. But to find a pharmacy that has that discount integrated into their software can make a big difference. And I have only found one in this area, and it's Staywell Pharmacy. They're up in Gainesville. You do not have to show up there. You can call them or you can go online. And I personally have tried them, and I just transferred one prescription there. It was like, oh, there's a $30 month savings. Boom. So I'm plugging that. And if you're a vet, you have access to prescription drug benefits through the VA. My husband recommends you call the VA rather than try to reach them online, and I believe I gave you their phone number. And finally, VICAP. VICAP is a wonderful program. VICAP is short for the Virginia Insurance Counseling and Assistance Program, and this falls under the umbrella of our Rappahannock Community Services Board. And VICAP is part of a national network of programs that offers free, unbiased, confidential counseling and assistance for people with Medicare or about to become Medicare eligible. VICAP has trained counselors who can meet with you one-on-one to give you information so you're better able to make an informed decision. I'm going to show you next. Their counselors will help you compare prescription drug plans in your area. The VICAP counselors educate and assist older consumers with medical benefit programs, long-term care insurance, and Medicaid. VICAP also helps by explaining and enrolling people in Medicare Part D or Medicare Advantage programs, which can be very helpful. You could speak to an Orange County counselor, and I gave you their phone number on that handout. And I wanted you to know LOWLINC can take members to appointments for prescription consultations during Medicare open season. That starts in October, usually ends the first or second week in December. So you can call them or do a face-to-face. And then I was going to touch on the Inflation Reduction Act. Now, it's a landmark legislation that allows the U.S. Department of Health and Human Services to begin the process of negotiating for lower drug prices this year. A list of eligible drugs will include 50 Part D and 50 Part B drugs. Those selected will be the ones with the highest total expenditures. By 2024, the agency will develop which 10 prescription drugs will be the first one whose prices will be negotiated. And by 2029, up to 60 drugs will be subject to price negotiations. The first prices resulting from negotiations between Health and Human Services and the drug makers won't take effect till 2026. This will be for 10 Medicare Part D drugs.
10. Wow.
And then in 2027, 15 Part D drugs will have the negotiated prices. And then in 2028, another 15 Medicare Part D and 15 Medicare Part B drugs will be effective. And finally, another 20 Part B and 20 Part D negotiated price drugs will be effective in 2029. The drugs selected will be among the 100 medications that Medicare spends the most money on. The drugs selected for negotiation cannot have any direct competition from generic or biosimilar alternatives, and they have to have been on the market for a certain number of years. Lower prices means the Medicare program will save money while providing the same drugs to beneficiaries. And beneficiaries taking drugs with negotiated prices will have lower out-of-pocket costs. The money Medicare doesn't need to spend on medicine should help bolster the program's budget, reduce premiums, and improve long-term solvency. Now, beginning this year, in January, all Part D and Medicare Advantage plans had a capped insulin at $35 a month. That was big, I thought. And then starting in 2023, drug makers who raise their prices more than the general rate of inflation will have to pay Medicare a rebate for the amount of their price increases above the rate of inflation. Now, Part D changes, beginning in 2025, Medicare beneficiaries will not have to spend more than $2,000 a year on their medications. Before that, beginning in 2024, Medicare enrollees who have reached the catastrophic phase of Part D drug prescription, the stage that comes after the donut hole, will no longer have any out-of-pocket costs under Part D. And vaccines, do we have one of that? Medicare will cover at no cost to beneficiaries vaccines that have been approved by the CDC Advisory Committee for Immunization Practices. Among the shots to be fully covered is the shingles vaccine, which currently requires cost sharing for those with Part D. You have to get your shingles vaccine, really. Beginning in 2024 and continuing through 2029, Part D premiums cannot increase more than 6% a year. Be aware the premiums for these private insurance plans may vary widely depending on which plan you pick and where you live. All Medicare Advantage programs that include prescription drug coverage are included in these changes. So my biggest takeaway from doing this research is that we have to keep advocating for ourselves and be aware of these rising prices as a population, because we have power as a population, and as individuals. We've got to become savvy and stay savvy. And I hope this has helped each and every one of you in some way. Please remember Jen Hine will be here, as I will, on the 28th, and we'll start navigating these sites and show you how to work these portals. Now, questions? Yes.
I have one that my doctor just prescribed a medication. Called up my doctor, 3 months, $1,200, 1 month, like $562. Got to the CVS pharmacist, like corporate, and what they said, there's a new aspect to the law. And that's why all these companies are putting all the drugs on their formularies, because somebody's picking up that it only costs $89 if it's not on the formulary. So it's on the formulary, but it's $562. But if it wasn't on the formulary, it would have only cost me $89 a month. So it's something new. I mean, this is CVS pharmacist yesterday.
Wow.
And it's some kind of new law, because you know how it used to always go, that was a way of getting around, well, if your company won't put it on the formulary, then we'll pick it up. So CVS can't do that anymore because the companies are putting almost everything on their formulary, just charging you $600 a month.
So is the $89
I need to
medication
ask that.
still
I have the notes at home.
Yeah, so you need to go online. I would go online and research that and see if I can get it at another store.
Well, they went so much of the eye doctors yesterday, talked about a compounding company in Fredericksburg.
And there's one in Culpeper.
And then the thing is that they have preservatives in them, and the doctor wants one without preservatives. Right. So it's like...
Call Staywell Pharmacy.
I think I will. That's why I said I put that down here. I mean, it's just that I spent 4 hours on the phone yesterday.
Yeah.
You have to think also when you call an insurance company, like most companies now, almost everyone answering the phone, it's their first day on the job. So the man told me, oh, if you get Restasis, it's only $89 a month. But then when I got to the pharmacist in corporate, they said, no, that's $580 a month because I haven't met my deductible.
So yeah, that's a perfect example. So you're halfway through the year, almost halfway
Well,
through
fortunately,
the year.
I'm on no medication except something for my kidneys.
Okay.
So, and the pharmacist brought that down from like 256 to 37 by not going through my insurance. So that man you talk about at CVS, he's a genius.
Yeah.
He really is. And they should give him more than the cubbyhole they give him with 5 people running around them.
I know. Okay. Well, you have a perfect example.
You have to keep asking and
advocating.
And if somebody, even in your insurance company, says something you don't think's right, I said, how could that be? Well, the other person told me that that person did tell me the truth. And that's my humane insurance company not telling me the truth because the man didn't know.
So you, yeah, you didn't know. Well, you always start out at the lowest level when you call into a large entity, and you have to keep going up, up, up. Any other questions? Jen?
The Stay Well Pharmacy, I have the same problem you do with your voice. The Stay Well Pharmacy in Gainesville, when I think about Lake of the Woods, that's a long way from Gainesville. So do they have delivery or anything?
Free shipping and delivery within 2 to 3 days, the package is at your front door.
And it would be like in your mailbox kind of a thing?
Yeah,
Free? That's nice.
I know, I shouldn't be advocating for that.
But you're right to mention about online because there was a drug company that was like that compounding one that was doing the spinal tap stuff for arthritis that was killing people because it had bacteria a few years ago, maybe 5 years ago. This other company had the wrong product in their package for babies, and babies in this country died last month
Yes.
because of that drug. So,
You gotta
the United
advocate.
States, made in the United States, we're not even talking about other countries, made in the United States.
Doesn't mean it's perfect. I mean, I think our drug companies are excellent in their procedures. You can say what you want about, Medina, and how, I was in awe of how they rolled out the vaccine for COVID, just from a scientific view of it, that they could create that and get it to your local CVS so quickly, whether or not you wanted the vaccine. Was just a very interesting exercise in our ability to respond. And I'm not supposed to talk about personal things up here. Anything else?
Did you run into Medicare also having an online or a call service where they will also help you compare your medications and look for generics? Do they also have that kind of help?
Not that I'm aware of. But I would go to VICAP because they do have that.
Okay.
I imagine Medicare was inundated.
I started looking into the Mark Cuban site.
Yes.
I
Shark
mean,
Tank.
he's a billionaire, and what it is, really it is true, once you get on the mailing list, but it's not spam, you put in a drug you're looking for, and something I'm no longer taking, I got an email that it was available. But I'm saying I really feel his is on the up and up, because he has the
Mark
money to
Cuban
back
is,
it.
Yeah, no, the names I gave you, those are all legitimate. I think
Well,
they're all
that's what I
savvy
mean, but
enough.
somebody would think that, but the fact that he's like a Bill Gates.
Yeah, he is. Yeah. Well, thank you very much for coming today. I appreciate that.
Thank you.